Hello, my name's Professor Raj Persad. I practice from Bristol, South Wales, and Bath. I want to talk to you about erectile dysfunction and impotence. This is a phenomenon that affects many men for a large proportion of their lives, particularly if one is diabetic, or one has various blood vessel diseases, or has been involved in any pelvic trauma, such as road traffic accidents, and increasingly it is seen as a casualty of prostate surgery, in particular, prostate surgery which removes the prostate for prostate cancer. And in so doing, the nerves that are very important for erectile function are destroyed or damaged. So, what treatments are there available? There is a whole hierarchy from tablet therapy all the way to surgical treatment. It is very important that based on what the etiology of your impotence or erectile dysfunction is, that your clinician chooses appropriate medication or combination therapy to give you the best outcome possible. By this I mean, if, for example, you have had a radical prostatectomy and the nerves have been damaged irreversibly, no amount of tablet therapy in the form of Viagra or other similar compounds is going to help you to regain erection. We would move straight to using devices that will help you restore blood flow, and even injection therapy. It sounds awful, but actually is very effective when placed into regions of the penis with hypodermic needles. If these techniques don't work, then we come to surgical intervention for this problem. Now, I think only 2 to 4% of men actually require this, but if you have end-stage impotence, such as with complete destruction of the nerves, in accidents, traffic accidents, or having had your prostate removed, or even with end-stage diabetes. This is a very good operation in which penile prostheses are inserted into the penis. There are two types, inflatable and semi-rigid. The inflatable ones require a bit of dexterity. One has to manipulate them to blow up the rods in the penis with a small pump in the scrotum, so one needs good dexterity for this. The semi-rigid prostheses are those which are ones which are very effective when straightened out, but they can be bent out of the way, physically bent out of the way when they're not needed. So surgical intervention is a fail-safe. Not everybody wants to go for it. The majority of men can be managed with tablets, so long as the nerves have not been damaged, and combination therapies such as tablet therapy with vacuum erection devices are good conservative ways of approaching this problem. Last thing to say is that there are only a handful of surgeons around the country who are experienced enough to do this sort of surgery, as it's reasonably complex, and one has to be able to handle the problems and troubleshooting that may be necessary with the original surgical intervention. Finally, I'd like to say that in terms of men's health, we should not accept that losing erectile and sexual function as we get older is something that we should tolerate. It's very treatable. Having treated it, it's very good for your quality of life. And we know that people who have a regular cycle of sexual activity actually are healthier and live longer. This plays also into the testosterone story. As we get older, our testosterone levels fall. And testosterone is very important for male libido and for helping functioning of the blood vessels and nerves that lead to erections. Your clinicians treating you, therefore, will talk to you about the range of treatments available and what's suitable for you, but they may also wish to look at your testosterone level and whether supplementation of that is necessary. Thank you.